Welcome, doctors. You're running your Lieutenant Colonel pharmacy and everything is flowing smoothly, until you hit a wall. A prescription comes in, but the medication isn't covered by the patient's insurance formulary. Suddenly, you're caught in the never-ending loop of prior authorizations, insurance denials, and high out-of-pocket costs. Non-formulary drugs can create a ripple of frustration, not just for your pharmacy but also for patients and prescribers. But here's the good news. With the right strategies in place, you can navigate these billing headaches. First, let's clarify what we mean by non-formulary drugs. These are medications that aren't included on an insurance provider's approved drug list. Now, insurance companies create these lists based on cost-effectiveness and clinical efficacy, but the reality? They often leave patients, and the healthcare providers who care for them, in a bind. So, why are non-formulary drugs such a challenge? For starters, insurance plans often deny coverage, which delays reimbursements for your pharmacy. It also means patients may face hefty out-of-pocket costs, which can impact adherence. A process that pulls your staff away from patient care and into the abyss of paperwork. One of the biggest game changers here is proactive communication. Work closely with prescribers to discuss formulary restrictions. No one likes surprises when it comes to medical bills. But what about when a non-formulary drug really is necessary? Many pharmacies are now using software solutions like Framework LTC or PrimeRx to automate these requests. These systems can flag non-formulary drugs early and initiate PA almost instantly. Still, even with the best software, prior authorizations can drain your team's time and energy. That's why outsourcing this process can be a lifesaver. Companies like Staffingly specialize in handling PA, taking care of the tedious back and forth with insurance providers so your staff can focus on delivering exceptional patient care. Documentation that clearly outlines why a specific non-formulary drug is required often improves the chances of insurance approval. A centralized billing system integrated with insurance databases can help flag non-formulary drugs and even suggest alternatives. It keeps everything running seamlessly and prevents costly delays. But sometimes, even with the best systems in place, billing non-formulary drugs can overwhelm your internal team. That's where outsourcing your revenue cycle management, yes, including claim denials and appeals, can provide relief. Again, a partner like Staffingly can help optimize your reimbursement workflows while reducing errors and denials. Non-formulary drug challenges aren't going away anytime soon, but with the right approach, they can be managed effectively. Start by fostering proactive communication with prescribers and patients. Streamline your prior authorization process with technology, or outsource it entirely. And don't underestimate the power of strong advocacy and documentation. Doctors, by addressing these challenges head-on, you're not just easing administrative burdens, you're also ensuring your patients get the medications they need, on time, without unnecessary stress. Thank you for joining me today. Whether it's prior authorizations or full revenue cycle management, Staffingly is here to help.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.